As we get older, we can get descent of our cheek, and as a result, you get prominence of the eye bags and a disconnect between the eyelid and that cheek junction. These are typically the reasons when you would then possibly consider a mid-face lift. So what are these good reasons to potentially consider, or at least discuss with your oculoplastic surgeon, when to have a mid-face lift? The first thing is obviously those sagging cheeks. As we get older, the cheeks sag, the nasolabial folds, which are these folds here, become far more prominent as that volume comes down, and you get a disconnect between the eyelid and the cheek junction, and so that bony ridge might become more prominent. As a result, you can then consider a mid-face lift for this reason. If you get hollowness under the eyes, this might be a reason to consider a mid-face lift, but there needs to be some good cheek volume there so that when it's lifted up, that volume can then be used to try and cover some of that hollowness and improve the appearance and give you a fresher and brighter look. Another reason is for corrective surgery. So if you've had blepharoplasty previously and it's not quite worked out, there is a loss of volume or there is some retraction, we tend to consider a mid-face lift. This will then bring this skin and the volume up, and we can then use that to try and do that reconstruction. Another reason is potential trauma, and as well as facial palsy, where if there is asymmetry due to the descent of the volume here on those cheek muscles because of the nerve paralysis, we can try and bring it up to try and improve that symmetry. I hope that you find that useful.